Well, first of all, I'd like to welcome everybody to the Medical Marijuana and Wellness webinar series. Tonight's subject will be pain management and medical marijuana. This is a subject that we've discussed in the past. There's a few new slides and more information here tonight that you might find interesting. It's a subject that's near and dear to a lot of people's hearts. And as you can see, we'll talk in the webinar, it's the #1 reason why people use medical cannabis. I'd like to introduce a gentleman named Alex Ford. Alex is going to be one of my co-hosts tonight, and he's one that we've done a number of webinars, but I think has had a lot of experience using medical cannabis for pain management and treating a number of patients. So Alex, welcome.
Thanks for having me, Mark. Always a pleasure.
So tell us a little bit about yourself.
Yeah, I'm a community educator with Trulieve. So I basically travel around Central Florida and educate physicians and the community about Trulieve and the benefits of medical cannabis.
Well, great. You've been doing that for a while, haven't you?
Yeah, I have. Got in about 3 years ago, so I've definitely seen a thing or two when it comes to the Florida medical cannabis space.
Yeah, I can imagine. So anyway, what I'd like to do is maybe let's do this. Let's just drive right into the slides. I think that's going to be the best way to handle this. And what I'm going to do is I'm going to share my screen here for a second, so that we can take a look at the slides as we go along. I think we're there. Good. Okay. Tonight's webinar will be broadcast live on Facebook. And also I want to point out as part of our summer Canna Chat series. This series is we're doing pain management. Today we did dosing last week, or 2 weeks ago, and we did the how does medical marijuana work about 2 weeks ago. About last seminar we did on August 4th. On September 1st, we're doing one on anxiety and stress, which is also a very popular topic. So please feel free to join us. We'd love to have you, and it's going to be a very informative webinar. One of the things about pain, let's talk about pain for a second, because before we can diagnose what we're going to do with it, let's talk about what it is. Pain is something that's persistent, and it's one of the most common complaints that we hear from patients. Chronic pain is often misdiagnosed and mistreated. So what happens is that we have a situation with chronic pain that it's there, but doctors are having a difficult time diagnosing it. And the reason for that is because pain is a sensory perception. Sensory perception is something that is tied to tissue damage, or described something as something damaged, something where you have pain, your body's saying there's a problem here. What's interesting is pain also comes from a combination of senses, emotions, physical factors. For example, from post-trauma, from anxiety and fear, overwhelming stress, they also cause pain. What's interesting is the body uses pain as a protective mechanism, and it uses that to basically reactivate outputs to be able to react to situations. So for example, there's one called fight, freeze, or flight. So if you have a pain, you decide whether you're going to run, you're going to fight, or you're going to just stop. That's something that pain lets you know that there's a problem here and we want to do something. The other is that pain also tells us we have problems with muscle activity, heart rate, blood pressure, things like that. So pain is good. It's also a warning mechanism. It's something that's there that the body uses to basically protect itself. Now, what's interesting is that there are a couple different kinds of pain. One is chronic pain. And I was starting to mention chronic pain before, and I'm going to dive into it a little bit right now. Chronic pain is something that happens, it's been around for 3 months or more, and it occurs regularly. What's interesting is it's very hard to diagnose for a lot of doctors. And the reason for that is that doctors like to follow a formula. They like to find a problem and prescribe a pill for it. They prescribe a problem, find a pill for it. You know, one problem, one pill is the philosophy. And I'm not being negative, I'm just kind of stating what's out there. What's interesting with what they found about chronic pain is it's usually 2 or more conditions that's causing that pain. And some of those conditions are related to inflammation, which is something we'll be talking about. And so when a doctor's trying to diagnose it, because it's 2 or more conditions, for example, in my particular case, I have herniated discs in my neck, and I also have knee pain from 2 knee surgeries. So I have pain coming from a number of different areas, not to mention I might work out and get pain from just the workouts and things like that. So it's not just one thing that's causing the problem, it's a number of things. And that's why doctors have a hard time diagnosing chronic pain. About 3 years ago, a doctor told me that there's no such thing as chronic pain, and I told him it may not be, but it sure exists in my body. And I've been able to use medical cannabis to be able to handle that. The other pain that we face is what's called acute pain. It doesn't, it's something that's connected to an injury or an illness. I had a left knee operation. That's acute pain. They basically replaced my knee and I had pain after that. It usually lasts for a couple of months, if not a year, and then it'll tend to go away or tend to heal in the acute process. What's interesting is that chronic pain is one of the top conditions cited for long-term disability in the United States, and acute pain and chronic pain are the main reasons people use medical cannabis. So if you have pain, it's not uncommon. It's something that we typically see for a lot of folks. Now, let's talk about medical cannabis and chronic pain. If you have pain, what are your alternatives to medical cannabis? So if you decide I have pain, what do I do? My first option would be, let me turn to the opioids. Let me go to the doctors and have the doctors prescribe opioids. What's the problem with that? Well, opioids are great for short-term use. They are designed for short-term use, and they're designed to help relieve the pain for short-term use. The problem is if you use it for long-term, AKA for more than 3 or 4 weeks, it causes a lot of bad things to happen to your body, including to become addicted. Hence why we have the opioid problem, the opioid crisis in this country today. What's interesting with medical cannabis is none of those conditions exist. No one has died from medical cannabis. There's no record with the CDC, both recreationally or medically, of anyone dying from an overdose from cannabis. So it's interesting that cannabis is a lot safer, but a lot of people are still turning to opioids, primarily because the doctors and the medical system is really pushing it out there. The other thing that's interesting is that when you're using cannabis versus opioids, there's no liver damage that's done with cannabis. Cannabis, it actually complements and it provides the mechanisms for your body to be healthier, where when you use opioids and use things like ibuprofen, aspirins, things like that over a long-term period, you'll find it does kidney damage, it does have GI issues, that type of thing. So when you take a look at your alternatives, the pharma approaches designed to be short-term do work, but if you're using it for 3 weeks, 4 weeks or longer, they cause some problems. So that's one of the problems that we have that's out there. What's interesting is that if you're using cannabis, none of those situations occur. You're not going to get addicted. You're not going to have GI or kidney tract problems. In fact, if anything, it's going to help your body quite a bit. Now, where is medical cannabis effective? Medical cannabis is effective in a number of different areas. One is you can take a look at it helping in chronic pain, ALS, Parkinson's, epilepsy. If you go to PubMed, which is the directory here in the United States of pharmacology, where we actually go out, excuse me, not pharmacology, it's where medical science reports are studied or placed. The National Institute of Health has that database. You'll find that there are studies out there on medical cannabis in every one of those conditions. Now, what's fascinating is that because medical cannabis is a Schedule I drug, none of those studies are done here in the United States. Most of those studies, in fact, almost all the studies are done outside of the United States, unless they're what we call anecdotal studies, where they go out and they study people after the effect and not actually studying cannabis itself, but the effects of what's out there. There are different states that allow medical cannabis, which is great, Florida being one of them. And what's interesting is that it's an option when people have exhausted all other theories, all other therapies. A lot of people turn to cannabis as a second approach, when in fact they should be probably looking at it as a first approach, especially when it comes to chronic pain. So why do we know that this works? Well, there's a couple of studies that are out. I mentioned an anecdotal study that was done by the University of California, and it was done recently to go out and look at medical cannabis, look at pain, and to look at different pain therapies. And it actually recommended cannabis being one of the #1 recommendations for treating pain, both chronic and acute. The other place is McGill University. Now, why can McGill study it? Because they're Canada, and they don't have the recreational and medical cannabis is legal in that state, in that place. They're one of the top research universities in North America. And again, they found out that cannabis is a much better way to go. And then more importantly, in a 2019 study that was done by McGill University, we found out that 80% of the participants who participated in medical cannabis trials said that it was either very effective or extremely helpful in helping them with their pain. So there are studies that are out there. I think if you're dealing with pain, you've got to worry about whether this is something that the medical science community embraces. And the answer is yes. Unfortunately, because it's a Schedule I drug here in the United States, they're not the U.S. universities. There are, again, anecdotal studies, and that's why I brought up the University of California. This is a list of the different studies that are out there, and we will publish this to be on as a follow-up to this particular webinar. You'll get an email that will give you the video, that will give you the slides. It'll also provide some anecdotal information. We'll provide a list of all these studies, the references that we use to be able to put together this webinar. I'm not going to go through each and every one of them. I just want to let you know that there's quite a few studies out there. So this is something that we know works. It's something based on science, and it's something that we want to let you know you're fairly safe looking at this particular area. Now, I want to play a video for you from Sanjay Gupta's video, Weed 4. It has something that kind of relates here to pain and how it compares how cannabis compares to opioids. So let's take a look at this webinar, or excuse me, this video.
THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies. But that all changed in the 1930s. Opioids would go on to become a best-selling drug, and cannabis became increasingly fringe. In part because one kind of cannabis, called hemp, was a threat to big business. Hemp is a cheap fiber, good for making paper and canvas. It's more absorbent than cotton and could be used as a potential fuel.
So there were a lot of vested interests that sort of put cannabis down, took it away from the doctors, made it illegal.
So what's interesting is what we're really trying to show with this particular video is
THC.
Cannabis was something that was brought out. It was actually made illegal more for industrial, not science purposes, but it works very effectively in addressing pain and, more importantly, reducing the inflammation around that pain. Now, why does it work? We all have an endocannabinoid system, and that endocannabinoid system is something that was found by Raphael Mechoulam when he was doing the studies on medical cannabis, and it's found in every one of the mammals, all mammals that are out there. So ourselves, our dogs, our cats, those type of things, they're all there. What's interesting is how does that work? What's interesting is you take a look at the slide here, you'll see all the little blue dots and all the little light and blue dark dots here. These are all these receptors, CB1 and CB2 receptors in our body that your body uses to be able to manage itself. The endocannabinoid system is something that controls your memory, controls your appetite, your inflammation, your immune system, everything. What's interesting is CBD, CBN, THC work like a lock and key with the endocannabinoid system to provide the pain relief that you're looking for, and actually to help it manage itself. And it's broken down into a couple of different receptors. Number one, CB1 receptors, which are found in the central nervous system and also in the brain, and CB2 receptors, which are mainly found in your peripheral organs and associated with your immune system. Now, the cannabis plant is something that's really interesting. Alex, this is the famous cannabis plant. Do you want to talk about the trichomes and the terpenes here for a second that we're seeing?
Yeah, sure. So this is, some of the glamour shots that you get from cannabis these days. These are micro shots, at least the one on the right, showing some developing trichomes, and that's where the majority of all the medicine is going to be in those trichomes. That's where you're going to get the bulk of the cannabinoids, as well as the terpenes and flavonoids, which also play a huge role in the effects that you get from the medical cannabis as well. But we'll go into more of that later.
Yeah, what's interesting is these little what all the medical dispensaries, with all the dispensaries and with all the medical cannabis researchers are doing, they're looking for these little trichomes right here. This is where everything's all stored, and this is what, see all the little fuzzy parts that are over here. These are these guys kind of really blown up, and I think it's important as we go forward to talk about that, because these are broken down and have two different components. One is CBD and one is THC. So Alex, tell us a little bit about that.
Yeah, so I like to, I guess, compare the two most common cannabinoids, THC and CBD, in terms of pain relievers, kind of like you mentioned earlier, where, you know, everyone's probably heard of these. You know, everyone knows that you can get CBD over the counter. You don't need a medical card to get that. Now, the main comparison I like to draw is CBD is more like a anti-inflammatory or an analgesic. So it's like a alternative for, say, aspirin or ibuprofen, whereas THC is going to be more so your opioid alternative, which is going to come with intoxicating euphoric effects in, you know, high enough doses. But what's, you know, unique about this medicine is that the CBD is actually anti-euphoric. So that gives you the tool to be able to, you know, kind of limit the euphoria based on your symptoms, your tolerance, and a lot of other factors. So it gives you a lot more control.
Sure. Now, looking at cannabis, I know when I got involved in the industry years ago, there was a lot of talk about sativa and indica, and everything was sativa and indica, kind of almost centric. Tell us the difference between them, and then let's talk about what's happened in the last 8 years where we moved to hybrids.
Yeah. So it's, you know, I guess you could say a little bit of a generalization these days, because as you kind of touched on, most of the strains are just going to be some type of a hybrid. But it's still useful to categorize them in the three general strain categories that have been used for so long. Just kind of, it gives an easier snapshot of the expected effects, you know, before you try it. So the two ends of the spectrum are going to be the sativas and indicas that you see here. And then hybrids are going to be right down the middle. They can lean one way or the other, but they're typically going to be like a tweener. Now, a good way to remember them is indica typically puts you into couch. Okay, so what that tells us is that they're going to be more suited for nighttime, better for sleep, more relaxing. The sativa strains, that's going to be at the opposite end of the spectrum. Those are going to be more of your daytime types of strains. Are going to be more energizing and uplifting and not slow you down as much. But, you know, like I said, there's a multitude of hybrids that are going to be somewhere in the middle. And again, this medicine's very variable. Everyone, you know, might react a little bit differently, but we'll go into why you might get those variables here when we go into terpenes.
Sure. And what's happened is, as research has been done, we've learned a lot about what we call strains. And by being able to put various plants together, the cannabinoids together, we get what they call hybrids. And that's where it goes back to what you were saying. Something can be sativa leaning or indica leaning, meaning it has more indica components in it, cannabinoids in it, than sativa, and vice versa. But they could have both in there. And that's why do they do that? Because they're engineering a lot of these medical marijuana solutions to address particular medical remedies for various medical conditions. And not only are they playing a lot with the strains, they're also playing with the terpenes. Is that right? Is that right, Alex?
Absolutely, because in fact, a lot of the, most of what makes up the strain's individual effects comes from those terpenes. Because the terpenes, if you look at the cannabinoids as, say, like a vehicle, the terpenes would be kind of the drivers. So they really hone in and specify the effects that you get from those certain cannabinoids or different strains.
Yeah. Now, what's interesting about cannabis is it's different than the pharma world. The pharma world is take 2 pills and call me in the morning. In our world, which is the cannabis world, this has something that really tunes into your body. In other words, this is more of a medicine. It's the herbs act as a medicine. What they're doing is they're helping to complement your body and have your body produce its own medicine to help itself. Now, here's the problem. everybody has a different reaction to cannabis. And let me draw a parallel to that. People have different reactions to alcohol. If you decide to take, I know friends of mine that can have one drink and they're done for the night. I have other friends of mine that can drink the whole bottle and they're just getting going. And that has to do with your metabolism. And the same is true with cannabis. You know, how your metabolism reacts to cannabis will tell you if you are CBD, how euphoric, how much CBD you can handle, how much CBD you can handle, how much THC, how much of the combination. There's what they call finding the sweet spot. And there's a way to do that. And we'll talk about that a little bit later in this webinar. But really, it's something that you've got to pay attention to, is to find that right sweet spot. How much CBD, how much THC, and in what ratios? You know, is it, and we'll talk about a little bit about ratios as we go along, but take your time, go low and go slow when you get into medical cannabis. And if you've been in a medical cannabis and the products you're using right now aren't working, talk to your dispensary, talk to your doctor about really resetting, going low and going slow, and really finding out the sweet spot. And again, we're going to talk more about how to do that. But in order to find that, you really got to figure out what your tolerance is to THC. Once you do that, you back down from that. And then what you do with the CBD side is you raise that to hopefully not only help give your body the medicine it needs, but also reduce a lot of the inflammation. And inflammation is something that causes a lot of the problems that you have with pain itself. Now, here is what they call the cannabinoid CBD wheel. And you can see that there are CBD, this isn't all the medical properties of cannabis. There's 450 different medical properties, but these are some of the major THC and CBD cannabinoids. You want to mention a few of them, Alex, to kind of give us some highlights?
Yeah, so I want to point out that we've kind of touched on the terpenes, we've touched on THC and CBD as cannabinoids, but each one of these is its own separate cannabinoid and should be looked at and respected as its own separate medicine. And something that we'll go into later, I'm sure, the entourage effect, which is a term used to kind of refer to whole plant benefits from the cannabis plant. These different cannabinoids work synergistically. So all the science shows that, you know, THC is more effective with certain amounts of CBD present and vice versa. So, you know, it just kind of adds to the medicinal benefits when, you know, each one of these on their own, if isolated, has these specific medicinal benefits, and then combined, it kind of synergistically improves the medicinal properties of the medicine itself. Each one of these can be found in different combinations in certain products. Not all of them are isolated, but it just kind of goes to show that even not including the terpenes and flavonoids, which drive the effects a lot, each cannabinoid has a multitude of medicinal benefits on their own. And like Mark said, this is, you know, just a few of the benefits that these have.
And I should point out, you take a look at CBD over here, which, like CBG, for example, it helps with sleep, that type of thing. You see over here where you have CBGA, which helps with pain relief. Over here, it reduces inflammation. Those are very, very effective. But if you combine the CBGA with THCA, which also helps you sleep and reduces pain, and also with the Delta 8 over here, what you're doing is you're now making 1 and 1 is 3. So in other words, the THC and the CBD together, they act as a booster to give you something that really addresses that pain and also the inflammation. Now, right. A lot of people will tell you I take CBD and it gets rid of my pain. And really, CBD is okay for pain, but it's not great for pain. You really have to have a little bit of THC that's in there. Now, why does it work for some people? Because what they're really doing is they're reducing their inflammation. And when the inflammation goes down, it reduces the pain. One of the things I use is something that has CBD in it because it reduces the inflammation in my neck for the herniated discs. When the discs are not herniated, when they actually start reducing the inflammation, my pain does go down. And so that's why I'm always cognizant of making sure that I get the ratios of CBD to THC correct for my particular case, so I can be able to address that particular situation. Now, a lot of people in pain turn to Delta 8. You want to talk about Delta 8 for a second, Alex?
Yeah, that's getting a lot more popular, especially in you know, certain, I guess, CBD shops or smoke shops. You're seeing a lot more Delta 8 products, and they're able to label it as THC because it is THC, but it is a different isomer than the typical THC that's you think of and expect. So it's not going to have the same euphoric potential as your typical THC. I think they say it's about half as euphoric. That's going to vary based on your tolerance. And it does have a lot of benefits, but just like we saw on that wheel on the previous slide, if you can have a product that has all of those cannabinoids or multiple cannabinoids, then you're getting, multiple medicines in one product. And Delta-8 is a very significant cannabinoid. It's one of my favorite products that we carry are the Delta-8 ratios. I know they work well for Marc too. And none of those should really be overlooked. And it's if you're new to cannabis, you're hesitant to kind of step into the THC kind of waters, then the Delta-8 is a great option, as well as that THCA that Marc was mentioning on the slide before. And it's also important to point out too that a lot of these cannabinoids can work on different receptors. So THC and CBD, those work on the CB1, CB2 endocannabinoid receptors, but certain cannabinoids like THCA actually works on your serotonin receptors. And that's important because that means it's not competing for receptors with the other cannabinoids that could be in a medicinal product that you're consuming.
Sure. Now, what's interesting is Delta-8 by itself is effective, but it's Delta-8 and it addresses pain. It does not address inflammation. And again, in my case, I like to have something that not only has Delta-8 in it, but also has CBD in it. I use a product that's what they call a 1-to-1-to-1. That's 1 part CBD, 1 part THC, and 1 part Delta-8. That works very, very effectively. I think you call that product in your world, the Trulieve world, Laughing Buddha is the name of that particular product. But I also know you have a product that's CBD and Delta-8 by itself. And those are very, very effective for pain. I think you call that product Pink Lemonade, is that right?
Yes, we do rotate the strains periodically on those, but I believe those are our current offerings, and they stay pretty standard. But yeah, I mean, once we get into ratio products later on, I mean, the mantra of this industry is to start low and go slow for new patients, which means start with more CBD dominant products, and then kind of graduate to like a 1-to-1 ratio, and then incorporate more THC after that. But what Marc's referring to is using Delta-8 as, even like a shorter stepping stone because it has so much less euphoric potential than your typical THC, but it's still very, very effective.
Great. I'm getting a number of questions here from Anonymous. We'll answer those questions. In fact, I want to finish the segment and then we'll answer those questions because some of the answers are located in the slides we're going to be presenting. So we're not ignoring you. We'll just get that done in just a little bit. But Delta-8 is important. I think one of the other things about Delta-8 is the quality of the product. And I know that Florida state regulated dispensaries go through a very high standard of quality. In fact, there are 3 different quality tests that are done. A lot of the stuff that you buy in these CBD shops, there's no regulatory requirement for quality checks. The person behind the counter will tell you it's been quality checked, but if you ask them to show you the study or you actually try to find the study, they don't have it, or they don't have it for that particular bottle that you're going to buy. I know that here in the state of Florida, if you buy a bottle of a Delta-8 product, you can actually get that quality report from actually the vendor, from yourself, from Trulieve. Is that right? Is that right, Alex?
That's absolutely correct. So this is always going to be the case, guys, with anything that you can get over the counter. It can be a good product. It can be effective. But the fact will always remain that it's not regulated, like Marc mentioned. So no one is, really going and doing quality control checks on any of these products. Now, in Florida, every MMTC is required to have third-party certificates of analysis for every product that we sell. We make it very convenient. We put a QR code on every container. You can scan that and it'll take you right to the certificate of analysis for that particular batch. It'll show you a screen for over 100 different contaminants, heavy metals, molds, pesticides, and it'll also show you a complete breakdown of the cannabinoids and the terpene makeup of that strain and product. And it's very, very useful for a number of reasons because first and foremost, I mean, it's just transparency on the front end. You know exactly what you're getting and you can, trust, your medicine and what you're getting. And beyond that, it makes it very effective to compare different products and the effects that you receive from them to see, to hone in on, specifically what's getting you the most benefits. Is it a certain cannabinoid? Is it a certain terpene? Is it a strain profile? And being able to, access those certificates of analysis very easily really helps, patients narrow in on what works and what doesn't.
Sure. I know that a lot of times, in fact, in this particular case, we're using medical cannabis. We're using, in this case, Delta-8 to address our pain. And my recommendation is to get a quality product that will do the job. I hear from a lot of people that say, I used, whether it's Delta-8 or I've used some products, some CBD products, and it didn't work. And when I go back and I try to ask them, where did it come from? Where is the test done? Who produced it? It's not necessarily, the person behind the counter can't necessarily bring forward those studies and that information about that batch that's being sold over the counter that day. And that's what's really, really important. You can test a batch done overseas once, but that doesn't necessarily mean that batch is what you're picking up and putting in your pocket and taking home. So I recommend staying, especially for medical reasons. It's your body. We're not playing around. We have pain. Use a quality product. That's what I recommend. Now, I'm not against the CBD shops and those head shops. I just wish there was some way that they could have the quality control so it could make a cheaper product for the consumer. But unfortunately, that's not the political and the economic landscape that exists in the market today. So
right.
I'm very, very, very in favor of Delta-8 products. I just want to make sure people understand there are Delta-8 products, and then there are Delta-8 products. I'd stick to the ones that are tested and the ones that I know that that can work. I use a Delta-8 product and it works. In fact, people ask me, am I addicted to cannabis? And the answer is no. Every 6 to 8 weeks, I stop. I take a holiday. I let my body refresh. I let everybody. I want to make sure my body doesn't become lazy and stop producing the endocannabinoids that it should be. All I want to do is help supplement them. But the reason I come back to it is because I have 7 herniated discs in my neck, and with that many herniated discs, my neck taps my shoulder, taps it on my shoulder, and says, if something's not done pretty quickly about this inflammation, you are going to have some pain. So my recommendation is look at medical cannabis as an option. You're not going to get addicted. You can quit anytime. I don't have any withdrawals or anything like that. What I do have is I have the symptoms coming back that I was trying to treat. And that's the worst case, the scenario that comes into play. Now, we talk a lot about terpenes, and there are over 200 different kinds of terpenes in cannabis. Terpenes are the drivers. Terpenes are the things that actually help hone in on the medical properties of cannabis. Tell me about terpenes, and tell me about a few of your favorites, Alex.
Yeah, for sure. So these are some of the most exciting compounds in a cannabis plant because it's what gives it all that wonderful aroma and flavor. Sometimes, it can be a little off-putting for some people if it's, a combination that doesn't necessarily vibe with you. But that's usually a good tell that maybe that strain isn't going to be a good one for, your body or your medical condition. So these are very prominent terpenes in a lot of strains, and a couple that are, kind of good to point out in contrast would be like, say, the limonene and the linalool. So limonene or limonene, depending on how you want to say it, it's a prominent terpene found in citrus. So terpenes also, they're found in plants, vegetables, fruits, flowers, and even some insects make them. And they're flavor and aroma molecules. So the prominent citrus one, limonene, that's also found in essential oils and, say, body washes that are quote unquote invigorating, supposed to wake you up in the morning. Whereas something like linalool, that's found in lavender, so it's going to be more relaxing, and it's also commonly found in indica strains, which are better for sleep and more relaxing. Whereas limonene is more of a sativa prominent a terpene. So being able to kind of know the terpenes and their general effects, really gives you like a some foresight into the effects that you're going to receive.
Yeah, the terpenes like pinene, for example, have that piney aroma, the kind of like peppery aroma. Very, very good for pain. It's excellent for pain. The problem that you have with pinene is if you're suffering from PTS, it does help with memory. It brings back memories. So if you're someone who's PTS or somebody has a PTS situation, when you're going to your dispensary, when you're going and you're looking at buying a product, you can tell them either you want some pinene in it, meaning you're not sensitive, you don't have a PTS situation, and you want to address pain, or you want to stay away from it because of that particular situation. And the dispensary will help you find products that have the right pinene or the right terpene mix to give you what you want. I know one of my favorites is eucalyptol. One of the things I like about eucalyptol is it helps with things like decreased blood pressure. It helps with sinus infections. It helps with, it's an anti-inflammatory. That's one of the things I look for in the product that I use myself. I think myrcene is a very popular one. Tell us about myrcene.
Yeah, myrcene's really important. So, as we mentioned previously, it's important to touch on too here that terpenes, individually they are, medicinally important. Like on their own, these compounds have medicinal benefits just by themselves, and in cannabis, they're in combination with those cannabinoids and even more terpenes that have more benefits. So, but getting back to myrcene, that's a huge one. It's found in mangoes, and studies even show that if you consume some mango prior to consuming cannabis, it can actually kind of alter and intensify the effects somewhat. So, but what makes myrcene so important is that it's kind of the main driver in dictating whether you're going to get indica or sativa effects. If it's under a certain amount, it'll be predominantly sativa effects from the strain. And if it's over a certain amount, it'll be predominantly indica effects. So that's going to be probably the main one to look at if you're not treating something specific, like Mark mentioned, like PTSD or anxiety, where you're going to have to look out for some pinene. But myrcene is very, very important. It's not quite as prominent as pinene, because pinene, as you see there, is the most common terpene in the natural world. But myrcene, I'd say, would be a close second, if not tied for first, for ones you want to look out for.
Sure. And caryophyllene is interesting because not only is it an anti-inflammatory, but also it's an antidepressant and anti-anxiety. A lot of people prefer to have a product with caryophyllene in it because it's so effective to basically calm them and get rid of a lot of the pain that they have due to inflammation. So,
right,
and
definitely.
I'm sorry, go ahead.
I was going to say caryophyllene. It's found in black pepper, and that's actually one of the remedies for over medication is black pepper. So some of these terpenes can actually go into really honing and giving you that specific effect you're looking for. So if maybe less euphoria is what you're looking for, caryophyllene would be a great terpene to kind of highlight in the strains and products that you kind of look for. Sure.
Now I mentioned there's over 200 different terpenes that are in cannabis. We brought up the top 6. We could talk about terpenes. We're going to have a whole webinar in September on terpenes by itself. But it's something that it's a very interesting subject, and it's something that you should be aware of. It's in the cannabis product because it's not only strain related, but it's also terpene related. It helps you be able to address that situation. And I'm going to address that right now. So people ask, what are the best strains and what are the best terpenes for pain management? And I think there's a couple of them there are a number of them that are out there, but I'm going to highlight 7 of them. And again, for pain, you really have to put together a THC and CBD combination. CBD will help you with the inflammation, and it does a great job of helping you reduce the pain. But you have to have some THC to be able to really address and really counteract that pain that's out there. Now, it's also interesting that caryophyllene has played such a big role. A lot of researchers are finding that with caryophyllene, it's something that's really helped with a lot of pain management. But Alex, you want to take me through a few of these strains that not only have the strains, but also the terpenes that go with them and what they're good for?
Yeah. So it's, obviously we can see here that, first off, all these strains are prominent strains that Trulieve carries. And you can see right off the bat with the 3 most prominent terpenes in each strain, you'll see some similarities, right? So every single one of these is going to have prominent amounts of myrcene and caryophyllene, like Mark mentioned. So, strains that are typically more indica leaning, they are a little bit better for body pain and pain in general. So it, goes to show that these 3 strains that are notable for pain all have high amounts of myrcene in them. And you'll see pinene's present in 2 of them, and limonene. Those are more sativa dominant strains, but still great for pain. And you'll see that they're all, except for the blackberry kush, they have a CBD factor. So like Mark said, CBD is very important. And, not only balancing out the effects of the THC, but really, kind of amplifying those pain relieving qualities. And again, that's why it's important to kind of be able to access and reference those certificates of analysis, so you can see the breakdown of each product that you try and how much CBD to THC was in it and which terpenes were in it, so you can compare and hone in on what's best for you. Because at the end of the day, these strains are best in general for pain for most people, but they might not work perfect for you. There might be other strains that work better for you, and that's kind of the job that each patient has, trying to hone in on their sweet spot, like Marc mentioned earlier.
Yeah, and here's a couple 4 other strains that are out there, and again, you see the very common theme that's here. You're seeing myrcene that are in there. You're seeing caryophyllene that are in there. Also, what's interesting is a lot of them, for example, have different focuses. I'll take, for example, blackberry headband. It really helps you deliver for headaches, for head relief. It not only helps with that, but it also has a sweet berry flavor. I think one of the things that people don't realize is there's a taste to cannabis, and some people prefer their cannabis based on the taste that's out there. I like for example, I'm a big fan of the Skywalker products. I love them. I like the taste of that. And other ones, they're very effective, but I may not like the taste as much. Again, this goes to your personal preference. As you're finding your sweet spot, you'll find what you like with respect to the strains and terpenes, and also the flavor combinations that are out there. But I think that Master Kush is one that's been very popular. Is that right, Alex?
Yes, it's definitely growing in popularity. It's a very prominent strain that we carry, and very high in the caryophyllene, limonene, and myrcene. So it's and also want to point out too that although certain strains might have the same, say most prominent 3 terpenes listed, that doesn't mean that they're going to be in the same combination and have even remotely close to the same flavor. So even varying these ratios of terpenes slightly will impact the flavor and effects drastically, and that's really important to kind of remember and take home.
That's an excellent point. It's a matter of how much caryophyllene, how much myrcene, how much limonene, vice versa. It's in there. More limonene will give you that lemon flavor, for example. More caryophyllene will give you more of that peppery flavor. So you're right; those are all out there.
Right, but knowing these terpenes also gives patients, kind of like that I guess ability to kind of like use their nose to kind of see, once they get some experience, what strains they're gonna think are more, or know will be more helpful based on the smell and their prior experience. So it all plays a factor.
Yeah. Let's take a couple questions right now before we jump into the dosing methods and things like that. One of the questions, the top one that came up here is, it says, I have yet to get off opioids completely because of the 18-to-1 CBD THC still makes me sleepy and how can I ever get off completely? I'm on a very low dose. Do you want to address that one? You want me to take that one?
I'd love to take that one. So I actually have similar effects with CBD. I tend to be a lot more sensitive to CBD than I am THC. And you just kind of have to find out, dig a little deeper and find out why that is. Is it the certain brand that you're taking? Are you able to find out exactly what's in it beyond the shadow of a doubt? And then, are you THC sensitive as well? Or maybe you're more like me, where you're more THC tolerant, but the CBD, because for me, it just makes me almost too relaxed and too sleepy for like a lot of daytime application personally. But there's also products that have different ratios of other cannabinoids, say CBN, where we have isolated in a capsule, as well as in ratios with THC, which are wonderful for sleep, which we'll get into with some of these other questions. But I think, if that's the case, you just have to try a different direction. Maybe try to incorporate some delta 8, change the ratio a bit, but still keep that very small dose and micro dose and low and slow, so you can you don't over medicate, but you just have to mix some things up. So it's quite likely that the CBD might be a little bit too much for you, so might want to even out that ratio a little bit. Maybe try an 8-to-1 or something a little bit closer to that, or closer to 1-to-1, and see if maybe you're just maybe the THC is just going to be more effective for you.
Yeah, it sounds like the CBD is kind of the high ratio of CBD is the culprit. If you kind of tune that down, maybe go to a 12-to-1, maybe go to an 8-to-1, you try that out. It's clear that it'll do the job. You may not necessarily need to go with more THC, but I definitely would have a higher ratio of let's say
Exactly.
a higher ratio of
Exactly.
THC.
Higher ratio, maybe not more THC per se, but also remember that although THC is good for sleep, it is technically a stimulant. So, CBD is not. So, that's why, like Mark said, it might not be more THC that you need, I guess, in a quantity, but a different ratio for sure.
Yeah. I mean, there's a perception that the more I take, the better it's going to be. That's what we've got with food and a lot of pharma drugs, and that's not necessarily the case here in cannabis. You're mentioning here, I'm using a low dose. Even though you're using a low dose, but because you have so much CBD in it, what's happening is that's being the dominant force in how your body's being directed. So what you do is you can probably keep that low dose, but try a 1-to-1, try a 4-to-1, try an 8-to-1. And when you say 8-to-1, I mean the first number is CBD and the second number is THC. So try the 8 CBD with the 1 THC. Try the 4-to-1. Try the 1-to-1. Try that. Now the nice part about going to Trulieve is if you buy the product and you try it, it doesn't work, you don't like it. What can you do, Alex?
Yeah, this is a huge takeaway, everyone, because I don't know of another cannabis company in the U.S., the world, that has a return policy like we do. We really stand behind our medicine. We know it's expensive to see the doctor, to get the medicine. It's not covered by insurance, and we don't want anyone kind of leaving the program or not finding products that work because of the financial burden. So if anything doesn't work for you, you can't tolerate the taste or the effects just aren't what you expected, you can always bring that product back to Trulieve and we will swap it out for something else free of charge. And if we can't find something similar to kind of swap it, then we can apply store credit and let you use that against a different purchase later on. So you're never stuck with the product that you purchased from Trulieve, and that's pretty much invaluable.
Yeah, I didn't. When we talk about try different products, we're not trying to reach into your pocketbook and try have a bunch of dead products on the shelf. But Trulieve, exactly. You can actually go in and you can get it right. And I have taken products back to Trulieve, which is kind of interesting. I really enjoy that particular policy. And you're right, you're unique in that particular area.
Yeah, and even if you use half of it, 3/4 of it, almost all of it, still bring it back and give us a chance to land you on something else that might work better without costing you an arm and a leg.
Right, that's really, really effective. Second question is, I can't take sativa. It says I can't take sativa to keep me awake because of tremors. You want to take that one? You want me to take that one?
I'd love to take that one too. So I think that again goes back to sort of the ratio. So you're mentioning sativa, but what's the ratio of the cannabinoids? And that's why cannabis is a lot more complicated than just the pharma approach of the single molecule, one symptom, one molecule kind of approach. There's a lot of different layers, a lot of different variables. So although you might be taking a sativa strain, what's the cannabinoid ratio? How much CBD is in there? How much of the other cannabinoids are present? And that's going to play a huge factor in the effects you get. So although the terpenes might be kind of where you want because you don't want to be sleepy, that cannabinoid ratio might not be leaning you in that direction as much as you'd want. And the only way that you're going to find out, though, is by experimenting and trying new products, different ratios. And like we just mentioned, that's a benefit of Trulieve, is that if you get some products and they don't work, you're not out, $100 or $200. You can just bring them back and swap them out for something else that hopefully does work.
Right. Now, I think that, and again, in answering that, CBD and cannabis should help with the tremors. So this is where what you need to do is talk to your first of all, talk to your doctor, medical marijuana doctor, talk to your dispensary personnel. It's a good time to mention that Trulieve has a consulting program where you can actually call up, set up a consulting session. You can do it via telemedicine, or you can do it in the Trulieve office, and they can actually walk you. They can actually walk you through what products will be best for you. Is that right, Alex?
Yes, that is absolutely correct. We implemented this program around the time where the pandemic started. Our locations are known to be a little bit busier than a lot of our competitors pretty consistently. And for new patients that need a lot of help, have a lot of questions, it can be kind of intimidating to walk in with a crowded dispensary and kind of ask questions and take their time. That's why we felt that our virtual consultation program would be perfect because even if there's a technology factor, we always collect a phone number, and at the very least, what patients can do is block out 30 minutes in a experienced, knowledgeable consultant's day to get their questions answered one-on-one. When they go into the dispensary, sometimes they, you kind of roll the dice as far as, do you have someone new? Do you have someone with years of experience, that can really help you out? But if patients do, schedule one of those virtual consultations, which are 100% free, and you can do as many as you want, regardless of whether you're a patient or not, you will get someone that is knowledgeable and experienced to help you, that you can rely on to be at the store if you go visit it.
Sure. Now, one of the questions I was asked by Jennifer is that what strain is good for focus? And I think that any of the strains that have pinene in them would be good for focus. Is that right?
Yeah, I would definitely agree with that. I would say gravitate more towards the sativa strains for focus. Some, if the pinene's a little too high for you, it might be a little bit more stimulating and energizing than what you want to stay really dialed in and focused. But again, that just goes back to, everyone has to feel it out themselves. And one strain that's great for one person might not be the best for another person. So, strains high in pinene, limonene, things like that, low in linalool, low in myrcene should be good. But again, it's just trial and error at the end of the day.
One of the questions that came up, it says Delta 8 makes me euphoric. Well, you want to address that one?
Yeah, I'd love to. It's, that plays into, each individual's kind of tolerance level for certain cannabinoids. So like, I mentioned, I'm very sensitive to CBD, less sensitive to THC. And if you're very sensitive to THC, then you're probably going to be sensitive to Delta 8 THC too, since it's very similar. And you probably just have a very, high sensitivity to the euphoric effects of cannabis. But there's a lot of different ways to avoid that. Like we mentioned, CBD is anti-euphoric. So if you alter your ratio and take a more CBD dominant ratio, that can kind of limit that on the front end. You can have some handy to take it on the back end if you feel yourself getting a little bit uncomfortable. But there's also a lot of other alternatives too, like CBN would be one to kind of check out too. So CBN by itself can be a good THC alternative, and taken regularly, it's also a powerful potentiator for both cannabis products and pharmaceutical products. So that would be a good one to kind of look at, do some research and experiment with by itself. And then in combination with THC, CBN is second to none for sleep. Absolutely fantastic for sleep.
Yeah. Now, this is a prime example of Delta 8 by itself. If you're sensitive to THC products, it can make you euphoric. If you use a CBD Delta 8 product, aka a ratio Delta 8 product, which you typically don't find any of those in CBD shops. They typically go pure Delta 8. Then you'll find that it, in fact, will probably help not only reduce the euphoric effect, but also increase the effect of the pain relief that you're getting from Delta 8.
Right, and that's a big reason why we do pair our Delta 8 strains with caryophyllene. Is because that can also kind of hone in and limit a little bit of that extra euphoria that you feel from the THC. So even the terpenes can play a role in that as well.
Right, and also pay attention to the CBNs. That's important. It's there. Well, let's talk about. We have different strains that are there. It was one other question that came up, and it was one about I've got pretty severe back pain running down my legs. I'm supposed to get my second back surgery most likely next year. I got sciatica, spinal stenosis, two protruding discs. I want to sleep and be pain free.
I'd love to go into. So building on what we were saying, the best thing that I've found personally for sleep is going to be that CBN in combination with some THC. So, I'm a little bit less sensitive to THC, so I like to use it throughout the day for, my symptoms and pain relief mostly. And at nighttime, I like to add some CBN to it to kind of use that THC then to help put me to sleep and keep me asleep. So, and any physician or patient that has tried the CBN, it's hard for them to stop taking it. So that's definitely a very powerful medicine that I think everyone should probably check out, especially if you're looking for extra sleep.
Yeah, and I think a lot of times when people have sciatica problems and things like that, it sounds like a lot of this is related to inflammation as well.
Right. Yeah. Without a doubt. So, again, that goes back into ratios, making sure that you are getting significant amounts of CBD. And then beyond that, I mean, with so many symptoms and suffering from so much, I mean, as far as, specifically what should you get? I mean, I would recommend as much as you can to try and experiment with to see if, it gives you any benefit. But as far as sleep specifically, definitely the CBN in combination with THC. We have CBN capsules that are just CBN isolated by themselves, and we also have them in ratios in gummies with THC already. So we've got a few different options for you as well.
Great. Now let's talk about how to take it. I mean, there are different standard dosing methods that are out there. You want to take us through those?
Of course. This is another layer, another variable, I guess, in terms of what effects you can experience. So like Mark mentioned, there's a number of different products. There's actually 5 approved routes of administration by the Department of Health. So you have inhalation, oral, sublingual, topical, and rectal, which that's not used as much. But oral and sublingual are kind of the same. So essentially, the main takeaways is if you're using like an inhalation product, what that's going to be most closely related to is like a breakthrough type medicine. So when you inhale something, it goes from your lungs right into your bloodstream to your brain and then circulates around your body. So it takes effect very, very quickly. But it's also going to wear off.
On the vaping products, you're vaping more of a steam than you are. It's not like smoking cigarettes. This is more of a steam type of thing. Because you're not putting carcinogens in your body.
Exactly.
But again, anytime you put something in your lungs, you have to be careful. Okay. But what you're putting into your body is a lot more safer than what people perceive with what they call smoking. Vaping is very, very different from smoking.
Without a doubt, yeah. There's no combustion factor, so what that means is that you're not creating any carcinogens that you're inhaling. So it is just a vapor. So it's, like Mark mentioned, it's similar to like a steam. You will still feel the sensation, and if you take a lot, it can still be irritating, especially because of the terpene content, particularly. But it is a very clean type of experience as opposed to smoking. Now, some patients do report that the vaping is, too uncomfortable for them, and they're just used to smoking, and that's kind of where they find their sweet spot. And at the end of the day, as long as the patient finds relief, that's what matters most. I think
Robin asked the question: is vaping hard on asthma and lungs? And first of all, vaping does put something in your lungs, and so if you have sensitive lungs and asthma, be very careful. However, it's not the smoking like we're used to hearing with tobacco and things like that. So I would just say try it, and go slow. Don't take big hits to begin with, and see if that works. If it doesn't work, that's fine. I love the vape pen, and the reason for that is because when I have pain, if I take a hit from that pen, again using that Laughing Buddha, that 1-to-1-to-1 ratio product, which I just absolutely believe in, literally within a minute or two, my pain goes away. That's how fast it works. And so it's something that really, really helps me when I get up in the morning. I want to get rid of my pain immediately. I do take tincture drops underneath my tongue, but they take about 20 to 30 minutes to work. And they do last a little bit longer. Obviously, they last about 4 to 6 hours versus the vape pen that lasts 1 to 2 hours. But in combination, I can get rid of my pain right away in the morning, and I can also take my little tincture drops and carry me through the morning and into the afternoon.
Right. And it's very important to point out too that cannabis, when inhaled, is an expectorant, and even when smoked, it does have benefits for severe conditions such as even COPD. But like Mark said, it's this medicine is very specific, very variable. So everyone needs to start low and go slow. But you should still try and experiment with them because it could provide you with benefits you've never experienced before. And like you said, moving on from the inhalation products, we have the orals and sublinguals, and those would be, in contrast to inhalation, more so your extended relief or long-lasting medicines. So I think in a perfect world, if you say you're treating pain and you wake up and you're in pain, you'd want to use the inhalation routes, like Marc does, to kind of quell your pain, immediately, and then use your tinctures or orals to kind of extend that relief much longer throughout the day, and then use the inhalation in between to get you to your next oral sublingual dose. And then other products like topical products, those can be used, locally and in between as well, and provide, a number of benefits on their own.
Topical products were great. They very localized. Again, when I had my knee surgery, I used topical products on my knee, and it was very effective. It helped quite a bit. Not to be overlooked. But again, it depends on what your need is and what's there. I know a lot of the sprays are being used, like for kids that have epilepsy and things like that. They're using sprays as a mechanism to be able to, like vaping, it goes right into your bloodstream immediately, so it helps them with that particular situation. Right.
And what he's kind of mentioning is Trulieve has a nasal spray, actually, that's a very specific product, and designed as like a seizure rescue spray. And it's also very effective at treating migraines as well. And it's just, a THC saline type of solution that you kind of coat your nasal cavity with, and it, takes effect and starts working immediately. So there's some very special products that you really wouldn't have any exposure to or knowledge about until you become a patient and really start to, kind of dip your toe into these waters.
Yeah, and that's where talking to your dispensary, talking to your medical marijuana doctor, if you happen to have some practitioners, they can help you. They can help you quite a bit for that. I know that migraines are known to be something that it's a cannabis deficiency that's in your body. Now, again, it goes back to making sure that you get the right ratio, the CBD THC ratio. But there are very products and strains that are designed to really address that. So, flower is popular. People have the perception that everybody can, buy flower, roll a joint, and smoke it, and they can. But also, flower is fairly popular for cooking.
Yeah, you're definitely not wrong there. Once flower became legal, it quickly became about half the market, and kind of quietly so. I think the reason for that is, although a lot of people, kind of are a little bit hesitant at first towards, consuming the whole flower or maybe the smokable route in general, but it's kind of like a surefire way to make sure that you're getting full spectrum benefits out of your medicine. So like we touched on earlier, the combination of cannabinoids being present in one product, is really a huge benefit. It helps all the other, cannabinoids and individual medicines work more effectively, and that's what you have in flower. It's just a foolproof way to, get those full spectrum benefits and effects out of your medicine. So you basically have one product, one plant, one flower with a lot of different medicinal benefits in it, and I think that's why it's so popular.
One last thing I want to cover is edibles. Because edibles, like capsules, go into your stomach. They're absorbed in your bloodstream, absorbed by your body. But also, once that absorbing formula, that process makes the cannabis a little bit more effective, a little more potent. Is that right?
Yes. So this is, again, we're getting into yet again another layer of variability with cannabis. So when you ingest cannabis, so that's what's unique about the sublingual route, is that sublingual refers to under the tongue, and that's referring to absorbing the medicine under your tongue and in the capillaries of your mouth. So what that means is that the cannabinoids are being absorbed into your bloodstream straight away through those capillaries without having to bypass the liver, like if you were to take a capsule or eat an edible. And why that's important is because cannabis does some interesting things after it makes it through the liver. So the typical THC is referred to as Delta 9. We've talked about Delta 8 being the over-the-counter type of THC, but there's a different type of THC that gets converted by your liver called 11-hydroxy. I don't want to go too far into it because it's already like drinking water from a fire hydrant, trying to learn all this stuff. But it's like Marc mentioned, it is 5 to 7 times more potent and more effective at binding to your receptors than regular THC that you would say inhale or absorb sublingually. So it does change the effects drastically if you ingest it as opposed to inhale it or let it absorb sublingually, and that's very important to remember. And basically the takeaway is that it's going to last a lot longer and be stronger. But it can take up to 2 hours a lot of times for those ingestibles to really take effect.
Excellent point. Have patience, grasshopper.
Yes.
You know, if you take it, you don't feel it after 30 minutes, don't take more.
Right. Wait at least an hour and a half, 2 hours.
Yeah, you'll be double dosing. So yeah, that's one of the famous problems that they have with edibles.
Yes, and that's actually a personal problem that I have too, guys, because I can take a gummy or a capsule and I don't feel it for 2 hours. I forget that I took it, and all of a sudden it comes out of nowhere, and I forgot about it, and it kind of throws me for a loop for a little bit, and that can be kind of alarming, a little bit uncomfortable for some people, and that's why it's important to remember, and keep in mind, whether you're ingesting it, inhaling it, or taking it sublingually, because it can really vary the effects.
Right. Now, Pam asked the question, what's the best delivery mechanism for migraines? I found that for immediate relief, this is your vaping and your sprays. And she was asking, where do we find the sprays? You have sprays in Trulieve, right?
Yeah. Just like I mentioned with the nasal spray. So basically like if to control and stop migraines. So if we're talking about like, one is already coming on and we need like an SOS type medicine, then without a doubt, the inhalation routes and the sprays would be included in that. So the sprays would, apply the medicine right to your nasal cavity to be absorbed, immediately. If you inhale it, it goes from your lungs right to your brain, right? So it's going to bathe those cannabinoids first if you inhale the medicine. But if you take it, say you ingest it or take it sublingually, it's going to have to work around your body and then get to your brain. In your head. So that's why you can, delay the relief, especially if, you need the relief in the brain head area because you're suffering from migraines. So something that's inhalable or gets applied directly to your nasal cavity is definitely going to be the most rapid relief, especially if you're feeling one come on. Now, as far as, kind of like a preventative medicine, then that's where something, like kind of like a daily, oral or sublingual dose, a couple times a day would probably do the trick, but it's going to take time to kind of, find your sweet spot and get that dialed in.
And again, in fact, Trulieve handle has sprays. I think most of the dispensaries have sprays today. That's where you can find them. We put together this chart. I think we've gone through all the different routes of administration, and we've talked about the pluses and minuses about how much time it takes to work and how long it works. This will be, again, in the follow-up, you'll get a email that has a copy of this video. It has a copy of the slides. And so you might want to take a look at this if you're looking at comparing the different routes of administration, how long it takes to work and how long it's there. I think it's something that's very, very important that we included that for your reference, and you'll find it in the package of information that you get. So let's wrap this up a little bit. Let's talk about dosing. As I mentioned earlier, dosing is very similar to really in alcohol. Some people like, again, one drink, they're done. Whole bottle is still going. Some people like light drinks, vodkas and gins. Some people like dark, like the bourbons and that type of thing. Some people prefer to have an umbrella in it, and some people want it over the rocks. Cannabis is much the same way. You'll find out what works and what you like and how much you can take. That's what's important. That's one of the reasons I like Trulieve, is because you can try a lot of different things and find out what works. But that's the most important thing, is to find your sweet spot. What is your tolerance to CBD, and what is your tolerance to THC? And it's something that's interesting. The golden rule says CBD for inflammation, THC for pain. But I found that there's some mixtures in there where I use CBD, it reduces my pain because it's reducing the inflammation. Okay. So, and then also some people like yourself, Alex, are tolerant to CBD, right?
Yeah. And I mean, this, like we touch on, numerous times, this medicine is so different than what everyone's used to with your typical pharmaceuticals. I like to try to compare it to math almost, whereas if you have one variable, it's like addition, subtraction, very simple, straightforward. Once you add two variables, now you've got algebra. Now we have equations and we can draw lines, and you add more variables. Now we're getting into calculus, and cannabis is complicated as calculus. There's so many different levels and factors that you have to explore all of them. You have to explore the differences in the routes of administration. You have to explore and experiment with differences in the terpenes and strains, and you also have to explore and experience the different ratios of cannabinoids. And, all these things combined based on, your symptoms and your specific body type, goes into, what you're going to experience, and the relief that you're going to get. So, start low, go slow, but you're really not going to be able to.
Also, it's not quite as bad. I know there's a lot of combinations, there's no question, but I think that when you're working with your medical cannabis doctor, when you're working with your dispensary, when you have some practitioners that can help you with it, they can cut through a lot of the alternatives. They can just say, look, Alex, based on your situation, on your tolerance to CBD, here's what I recommend. They can give you 2 or 3 or maybe 4 alternatives, probably 2 or 3, rather than having you try 10. So really, by working with, take advantage of the consulting that you get from Trulieve, take advantage of talking to the bud tenders, and what it does is it kind of hones that down to a very small number of alternatives that you test to be able to find your sweet spot.
Right. Yeah. The takeaway is, kind of collect as much information as you can from your own experiences, lean heavily on the dispensary staff, as well as your physician and recommending clinic staff to, collect all the knowledge you can so you can find that sweet spot sooner rather than later.
Right. And listen to your body. When you're doing this, forget what the doctor tells you, forget what your body will tell you if you get a euphoric, your body will tell you if you're not. Typically, if you get euphoric from THC, you can take some CBD and it'll bring you down. The point is that listen to your body. Your body is the best, let's just say, the best recommended, best judge, the best doctor you can have. Your own body will help you to decide what works and what doesn't work. So what's the bottom line of all this? Well, I think first of all, you're not gonna get high. You're in control when you use medical cannabis. You can decide how much of THC, how much CBD, what is the terpene blend. You're actually being able to home in and find your sweet spot, which is something that it's kind of like the shotgun blast with opioids. It's more of a rifle shot with cannabis. When you find your sweet spot, when your body tells you, hey, that starts working, it is a wonderful thing. And again, it only took me about 2 weeks to find my sweet spot. And when I work with a number of patients, I try to limit the number of alternatives to be able to have them be able to find the sweet spot sooner rather than later. And again, usually within a week to 2 weeks, maybe 3, it'll tend to work. Now, there are some cases, like in Parkinson's, that may take 2 or 3 months because of the nature of that particular condition. But most of the time, within a week or 2, you can actually find the alternative if you're working with the right and professional people from the doctors and from the dispensary standpoint. The other thing I think is important is you're not going to get addicted. As opposed to other opioid and pain medications, that really addiction is an issue. This isn't the case. It's here. And then also, we talked about the entourage effect. What is the entourage effect? The entourage effect is you take cannabis for one reason, and all of a sudden it helps something else in your body. For example, you take cannabis because what you're doing is you're trying to address pain, and you find all of a sudden you sleep better. And that's because as you're reducing the inflammation, as the terpenes kick in, it helps you with the relaxing and de-stressing, it helps you sleep better. I had one of the mechanic that I use on my cars. I have foreign cars, and so he actually started using medical cannabis because of pain, and he hadn't slept through the night literally in over 20 years. And he called me about 2 weeks later, and he said, "It does help with my pain. There's no question about it. But let me tell you what the big help is. I'm now getting a good night's sleep for the first time in a long time, and that's what's important. You take your body knows where your problem is. It'll produce the endocannabinoids to solve that problem. And even though that's not your primary issue, it's your secondary issue. My mother used it for breast cancer, to address her breast cancer, and she found out her glaucoma went. So that's what we mean by the entourage effect. It is something that's really out there. So wrapping that up, tell us about Trulieve.
Yeah, so Trulieve is a little unique. We were the first dispensary opened up in Florida, and we're also the largest right now. We do have the most locations. We do put patient access to natural, safe, alternative medicine as our first priority. So we try to have enough locations that everyone's close to one, and a wide variety of products that everyone can find something that works for them. And, like I said, we've got one of the best return policies I've ever heard of in the cannabis industry. So you really can't go wrong if you're a new patient and you're really trying to find out what works and what doesn't. And looking into our products.
One of the other things you have is you have a very cool nanotechnology. Nanotechnology is where you're actually, well, explain it, how that works and really the effect it has. It's really something that's rather remarkable to help bring the medical properties to your body.
Yeah. Diving in on, one of the factors that makes our product line so diverse and effective is going to be our nano line. And what the true nanotechnology is referring to is the process of using sonification or sound waves to make the cannabis molecules smaller and more easily absorbable. So essentially this line, if you see, true nano on any products, whether it be a tincture, gummies, a powder, the absorption is going to be 2 to 3 times what it would be if it wasn't a nano product. And they're also going to take effect much, much faster. And why this is so important is because these true nano products are actually able to be an inhalation alternative. So, these products are going to be tinctures, gummies, powders. So they're going to be oral or sublingual in nature, but their absorption and bioavailability is so high because of the nano emulsification that they can actually be an alternative for inhalation products as a breakthrough medicine. So they tend to be a little bit more expensive than non-nanotechnology, but it's well worth it, especially if you're a new patient and, vaping and smoking maybe, isn't the first thing that you want to kind of dip your toe into. And if that's the case, then the True Nano line is going to be perfect for you. You just want to make sure that you allow these products to absorb under the tongue for enough time to where they can actually get the bloodstream rather than just, swallowing them back and ingesting them. But that's the main factor. Otherwise, you have basically a alternative to smoking and vaping in the True Nano line.
What's interesting is that nanotechnology helps the product work faster and you need less of it. That's the bottom line. And so that really helps quite a bit. You also have a true powder, which I think is great to use for shakes and coffee and things like that, which can help in a lot of different cases that are out there. Now, let's talk about the ratio of products. So we talked about those earlier about your 1 to 8s, 8 to 1s. Take us through. You have different route standard dosing methods for these.
Right. And there's layers to this too. So we have ratio products and all kinds of different routes. Sorry about that, guys. All kinds of different routes and products, and also different combinations of cannabinoids. So your typical ratios are going to be THC to CBD. So we have that in concentrates as well as vape carts and as well as edibles and capsules. Now, when we get into the Delta 8 ratios, so it's incorporating that less euphoric THC. We have those in inhalation, oral, and sublingual. And the true gels or the edibles is where we kind of started mixing things up and incorporating CBN ratios. So you'll see that we have some CBN to THC ratios. Those are going to be the best for sleep. Now, the CBN CBD ratios, those are going to be the best for patients that have high sensitivity to THC or are very sensitive to the euphoria from the THC. So CBN can be a THC alternative, and combined with CBD, it can really amplify those effects. And then, of course, just the regular CBD to THC ratios in the gummies as well. So lots of options in terms of ratios. We have 8 to 1, 1 to 8, 5 to 3s. So, a number of ratios. And we also have the products available to where if we don't have the perfect ratio for you, then you can most likely engineer one of your own once you get some experience that can be a little bit more tailored to, your body type and symptoms.
Sure. Now, delivery and pickup, this is important. You have one of the better delivery programs in the state.
Yes, we do. And we've had that since day one. So since day one, we have delivered everywhere in the state of Florida. We did only go to the Keys twice a week initially, but now you can get deliveries every day of the week in the Keys. Typically, we have next day delivery if you can place your delivery by 2 p.m. In a lot of locations, we're bringing our same day delivery online if your order can be placed by noon, which is super convenient. And deliveries don't have to be to a specific location as well. So we can delivered to home, office, or somewhere in between. We notify patients beforehand to confirm the order and the price, and we also notify them the day of and when we're about 30 minutes away. Our pickups are fast, easy, and convenient as well. You can actually check in online before you even get to the store to kind of see what the wait time is. And once you check in and see the wait time, you can kind of gauge, when you need to be there, when you need to show up, so you're not just stuck waiting, for however long that it takes.
I know, for me, that's been very helpful because you get a lot of people in the store. I can actually call. When I get in the car, I give a call. And by the time I get down there, they're ready for me. I go in. It's very, very efficient. I really like that. And sometimes I need to talk to the people behind the counter. So,
right, yes. Sometimes you need some questions answered, and that's perfectly okay too. And one more thing I want to point out is that we do charge a $15 delivery fee for standard deliveries, but anyone that's 65 and over is eligible for free deliveries. 100% of the time. We implemented that during COVID, and as well as if your order is over $200, then it's free as well. So there's plenty of ways to not have to pay for that delivery, and it's very, very convenient.
That's music to my ears, I can tell you that. And discounts.
Yes, discounts. So anyone that's, has this mentality that Florida's medical market is more expensive than other markets, I really feel they just don't have a good grasp on the amounts of discounts that every dispensary offers. So Trulieve specifically, we offer a new patient discount we recently changed it. It's actually 50% off your first order with no limits right now. So your first order, you can get half off anything that you want. And we also give a reoccurring annual discount of 75 off 150 or more. Now, the reason for that discount is because that discount is in place to offset the yearly annual state fee that patients have to pay the Department of Health of Florida just to keep their card active. So, Trulieve kind of feels like that's a barrier for patients. So we like to refund that cost in product every year. So, once a year you have to pay that $75 fee, and once a year we will give you a $75 credit to use off your orders. Beyond that, we do a loyalty discount, 10% off once you reach a certain amount of points. Seniors receive discounts every Sundays. If you have SNAP card food stamps, you get 10% off every order. Veterans get 20% off every order. And you also get a 25% off discount during the month of your birthday to use one time. And this is completely separate from any daily deals or weekly deals or promotions that we might have going on. So there's really no shortage of deals and promotions in the industry, I'd say.
And they're stackable.
Exactly. I was just going to mention a lot of these are stackable, and you can combine them. So there's really endless ways to avoid paying full price for any of your medicine here in Florida.
And seniors get 10%, which is great. So.
Correct. Every Sunday, seniors get 10% off. And we also do extra specials typically on Sunday too.
Well, listen, Alex, we've covered a lot of subjects today on pain management. We've talked about cannabis. We've talked about Trulieve. You guys got some great products. I think it's important for everybody to wrap this up to understand that, cannabis is not like fairy dust or a magic wand. It needs to be put in place with respect to the lifestyle that you have, some balanced living, mindfulness, meditation, your self-care. I get a kick out of people that hit the gym, work out vigorously, and then the next step is the bar. It's kind of one of those things. You got to kind of, self-care goes a long way, but it is something to really look at, and it is an alternative that a lot of people have used. Very, very positive feedback on the pain management side, and it's something that we really recommend to take a look at. Alex, do you have any closing comments?
Yes, I do actually. The amount of people that I've come in contact with, in my time in the industry, is absolutely mind-boggling in terms of the effect that this medicine has on every type of person that you can imagine. I've had crazy success stories from ex-law enforcement officers that used to incarcerate people for this medicine, and now they use it and are just blown away by the amount of relief and benefits they get from it. I could fill a stadium with the amount of patients that suffered from cancer or some other life-threatening disease that received death sentences from their medical professionals that wouldn't be here if it weren't for cannabis.
Right.
So, I mean, there's, I've spoke to parents that, have just affirmed that, like their, children couldn't play outside if it weren't for their daily cannabis. So, I mean, it's a miracle to, countless people, but I think it's at the bare minimum, it can be extremely life-changing for almost anyone that suffers from any sort of pain-related ailments. I mean, especially if you don't have any experience with it. I mean, it can really change your life.
I mean, it's been demonized for so long and drilled into us. And then all of a sudden what we did was we found out literally about 20, 25 years ago, this isn't going to kill you. In fact, if anything, it's going to help you. And it was for political and financial reasons. It was not for scientific reasons. And let's go back to the science and let's look at the science of what it does, because in this particular case, this science will help you get rid of your pain. It'll help you sleep through the night. It'll help you get your life back.
Right. And any, commercial anyone sees on TV about a pharmaceutical, there's that, speed spoken list of side effects, and, cannabis, the most predominant side effects are going to be hungry, happy, sleepy. And the only way you can die from cannabis if you get crushed by a ton of it, you choke on a lot of it. And other than that, it's fairly safe. So, it's something that's, anyone suffering from chronic pain should really, at the very least, experiment with and see if they can find benefit from.
Well, listen, I want to wrap this up by saying thank everybody for coming tonight. I know it's an important subject. I hope we've helped someone get their life back. My objective with these webinars is if just one person tonight can look at this and head down a medical marijuana path and get their life back, then I think we've been successful, and hopefully we've given you information to be able to do that. And we wanted to not confuse you. I know that there's different options and things that are there, but we also wanted to have you understand that those options mean that we can really home in to find your sweet spot and use the professionals that are around you. Use your dispensaries, use your doctors, use your cannabis practitioners, use educational seminars like this to be able to help you. So again, thank you very much. I want to thank our moderators, Lee and Deja, as usual, did a great job. And our next medical marijuana webinar will be on September 1st. I think Alex, you're doing that with us again, and it's going to be on anxiety and stress. So please join us. And again, thank you very much. We appreciate your time, and have a good evening.